Hi guys, Nasteri here. Welcome to Fertility Glow. It's been a minute. But we are here. Today we're gonna talk about why you are still struggling or why you are struggling to conceive, especially after hormonal or after birth control. So if you've been or if you've ever used a hormonal birth control, either the pill, the implant, the hormonal IUD, the patch, whichever that maybe you could have ever used, and you're struggling to conceive, I want you to watch this live. I want you to join in. I'm gonna give you a few minutes to join in so that we can just go straight to the point and talk about why you are still struggling to conceive after birth control or after using this birth control method. And just going through some questions here with me. I have some lots of questions here, and a lot of them are on Depo. And I don't know, guys, why do you want to use Depo? Why do you want to use Depo Provera as your preferred method of birth control? Do you know that currently Depo has been that the manufacturer of that product has been, or there's an active lawsuit against that product because it has been linked to being to causing brain tumors or brain meningiomas. So why would you want to use such a product? I just want to know there in the comment section. I For me, this is the worst of them all, and I do not recommend it at all. And especially if you are still in your reproductive age, like you are between let me say 21 all the way to 40, because in there you want to conceive. And even for women above 40, nowadays women are getting children when they are still maybe older, which is totally fine. Like, we are supposed to get pregnant when we want to, when we feel like, because pregnancy is also a mental you need to be prepared also psychologically. I feel like I'm talking to myself because there's still no one in this live. Please join in, and let's keep warm. Let's keep warm here together. So there are some questions here. I'm just gonna read them as you come in. um Depo, what is it? Does Depo cause weight gain in hips? So for this one, I know a lot, some of you may be asking it because maybe you want to have weight in your hips, or some, to be curvy. Maybe that is what you're looking for. But I would say, maybe to answer this, yes, in as much as yes, it can do that, but it depends. If you use Depo to gain weight in your hips, and it causes a lot of other reproductive health issues, then I don't know whether the benefit outweighs the risk there. You need to be wise. You need to be wiser. Take care of your body. I would not recommend you to use Depo to gain weight in hips, because that is not a very wise thing to do, because the Depo is not a good thing. Actually, it's not even good for anyone. I'm really sorry to say that. Depo shot help gain weight in hips? For some women, you on hormonal birth control method, they may gain weight, others they may lose weight. So you may not know whether it's going to favor you in that way. And why would you even want to gain such weight from these hormones? Do you know that they also disrupt insulin, or they can cause insulin resistance because of this high weight gain? And when you have this high weight gain and this insulin resistance, definitely you know that you are predisposed or put at a very high risk of getting diabetes later on, type 2 diabetes, that is. So I'm still going through some of the questions that you guys have asked me, and one of them is a lot of the questions are on Depo, but in this live session, I want us to address the question you are struggling to conceive after using the hormonal birth control methods. So there's a lot of questions from TikTok. There are definitely these ones are from TikTok, but I want to answer it all across the platforms here. Another one is the 3 month short safe for women over 40. No, it is not safe for any woman. Don't take Depo-Provera. It is not safe for any woman. Yes, it may help prevent pregnancy, but the outweighs the risks here. Check out the current lawsuit that is already ongoing. It has been sued for causing brain tumors, and especially for women who have used it for quite some time. So I don't recommend it at all, at all, at all, at all. Depot starts to work after how long? For any hormonal contraceptives, they normally start working from 5 days to 7 days. Thereby, they're going to start working inside your body. And what this means is that they're going to start producing or depositing synthetic hormones inside your body. And these ones, they normally have a long-term effect on your body. As if you're new here, you know that I've used all these methods. I've seen or I've counseled hundreds of thousands of women who have used these methods, and I do not recommend them nowadays. I don't recommend any of them. I'm actually teaching women how to transition from using hormonal birth control methods to natural birth spacing, because that is the safe option. There are no side effects involved. Your hormones are not going to be interrupted in any way. Your libido is not going to be affected. And it works. Like they lied to us. They lied to us that natural birth spacing does not work, but it does work. I've used it now for almost a year now, and it does work. You just need to know how to do it, because these hormones pumped inside your body, they do a lot of damage to your hormones, to your natural hormonal production. They are gonna do a lot of damage, and that is why a lot of women are still struggling to conceive even after stopping the birth control methods, because the synthetic hormones that were pumped inside your body, they are still very active. They are blocking the communication between your brain and your ovaries, and the natural hormone production has been cut off, or your body is not even responding to the natural hormone production. I want you to, as you come in, ask a question there. If you are on any hormonal birth control method, if you are experiencing any side effects, I want to know. And maybe in our next live, we're gonna talk about this. We're gonna go through some of the complaints that women send me, or that I have seen in a lot of forums, and we're going to talk about this because it is affecting, women are just keeping quiet. I know women keep quiet a lot. You're told it is normal. You're told, you should just feel the fatigue. It is okay with the hormonal, but you know that it is because of what they are doing inside your body, and we don't have to agree with that. We do not have to agree with that, because there is a safer option. And I'm going to leave you some resources there in the video description. You can join in the membership from my main channel. This is not my main channel, but in here we talk definitely about hormonal recovery as well. So I am gonna leave you some links there so that you can join in the membership from my main YouTube channel. It's Nasteri as well. So another question is, a lot of them are on Depot. Can one get pregnant on Depot? Definitely, yes, you can. There are some few women who have, but these are very few. A lot of times I see women struggle to conceive after birth control, especially after Depot, This one, I don't know, but the Depot is one of the hormonal birth control methods that may cause a delay in return to your fertility. On paper, it says 6 months to 1 year, but I have personally seen a woman struggle to conceive 7 years after stopping the Depot. And she had one baby prior, and she didn't have any problems conceiving that first baby. But after she started using Depot, she used Depot for quite some time. And again, women, I normally tell you that short-term methods should not be used for more than 2 years. Short-term methods are things like the pills. Even the Depot is a short-term method and should not be used for more than 2 years. So if you use the Depot for more than 2 years, definitely it's gonna pump because the dosage is normally so high. So the levels or the amount of synthetic hormones inside your system are crazy, especially if you used it for quite some time. Imagine there's even this woman I saw, she had used the depot for a whole 17 years. Like, why? Why would you do that to your body? Another thing is, what does the depot do to your body? Just answering some questions um here, and a lot of these ones are on depot, and we know that a lot of women who have been on depot may have struggled. Not all, definitely not all, a lot, but a lot of them may have struggled to conceive after stopping the depot. This is because the depot has a lot of, it has high dosage of the synthetic estrogen, the synthetic progesterone, and what these do is that they thin your uterine lining. They gonna reduce the quality of your cervical mucus, making it very thick so that the sperm cannot be able to penetrate. And then they are going to block the communication between your brain and your ovaries so that there is no communication. So when that communication is broken down, then definitely uh, your brain cannot tell your ovaries now it is time to ovulate, so you're not going to ovulate. You're going to miss your periods, or your periods are gonna be irregular, or just you're gonna just have spotting here and there, or what we normally call the withdrawal bleeding, and that does not mean that you're ovulating, and that does not mean that you are fertile. So how hard is it to get pregnant on depot? It is very hard, and especially if you've used this method for quite some time. If you've used it for more than 2 years, if you use it for more than 2 years, the harder it gets. That is a fact. I've seen it, but that does not mean that they are not women who get pregnant immediately after stopping depot. Yes, they are, and it also depends on how healthy are you? How well do you feed? Like, what do you eat even when you are still on that depot? Because if you eat well, if you eat supporting foods when you're still even on that depot, then definitely even after you stop, definitely your body's gonna snap back better as compared to a woman who just eats junk foods, does not exercise, does not detox. And right now, taking something here because you know that I was also on the implant and it did a lot of nasty things to my body. So this is my morning detox that I'm taking. And if you'd be interested in learning how to remove these synthetic hormones, because honestly very first step that you need to do. You need to remove these synthetic hormones from your system. I have a lot of recipes that work. Kindly check the links there in the video description. And also, I recommend you take the course so that you can be able to restart or reset your cycle once more. All right, so I'm gonna see whether there are questions coming in from YouTube. YouTube, please ask questions. I've answered all the questions from TikTok that I had. I need now YouTube. If you're watching from YouTube, please ask a question. Why you are still struggling to conceive after birth control? You need support. Your hormones need support. Your cycle needs support, and you can get this from our resources. There are links there in the video description. If they are not, then I'm definitely going to add them after this live. Please come back and check this live. And I'm gonna be able to, you're gonna find some links there to help support your hormones to reset your cycle so that you can be able to conceive once again. So YouTube, I'm still waiting for your questions. Thank you for the likes. Keep liking. Mhm. How do I know if I'm ovulating on depot? How do you know if you so for this question, how do you know, how do I know if I'm ovulating on depot? Definitely there are some signs that tell you that you are ovulating. For example, there are some women who have some pains either on the right or the left ovary. Um, so you're gonna feel some pain. Also, you there's also some other signs of that you're ovulating. For example, how is your mood? How is your mood elated, like you're very happy, your mood is really good? Are you glowing? Because all of those ones, they are signs that you're ovulating. And something else, your cervical mucus, has it become more thin or watery, or are you feeling wet down there? All of those ones can be signs that you're ovulating. Also, your temperature, you may feel during that time that you're feeling really hot, so it could be a sign that you're ovulating. Are you more attracted to the opposite sex? Are you feeling like your libido is up there? All of those ones, they are signs that you are ovulating. And whether you are on depot or not, so those are just common signs that tell you that you're ovulating. But the best way to know that you're ovulating is to take an ovulation test, to test the ovulation hormones, the LH, the FSH. There are tests that you can buy from your local chemist or your local pharmacy. They're going to test these hormones and they're going to tell you that it is either positive, so you have ovulated, or it is negative, like you have not ovulated. So that is how you can know whether you're ovulating. All right. So what are the side effects of the depot shot? Again, I told you, ladies, a lot of these questions are from TikTok and they are about depot. So if you'd like to also, if you've not followed me on TikTok, follow me as Nasteri. Also subscribe to my main channel, join the membership in there, because that is where hormonal support takes place. You need hormonal support, you need detox to recover you from all the synthetic hormones that were pumped inside your system. So the side effects here are the normal ones that you may know about is the cycle disruption, like your cycle is going to be disrupted. So for example, you may have no periods, or you may have irregular periods. You may be spotting. There are a lot of women I see spotting, like they tell me that they are spotting mid-cycle, after a week you're spotting, all of those ones. Also, some women, this is not for all, some women may gain weight, others may lose weight. Other women report that the depot made the acne go away, which is a good thing, maybe. But a lot of times the cycle disruption is a must. You are not going to be ovulating, because this method and all other hormonal methods, they normally uh, cause that to stop. They cause ovulation to stop. They cause disruption of your hormone. Again, there is also what they do behind the scenes that you don't know. They deposit a lot of synthetic hormones inside your body, and these ones can affect you trying to conceive later on, as I've seen. And there's an active lawsuit against Depo. You can Google that out. You're gonna see that. It may cause brain tumors later on in life, especially if you use it for many months, many years. Yeah. So what maybe as we wrap up, because YouTube, you're not asking questions. So I'm gonna take this last question from TikTok here. What happens when you stop the depot injection? Maybe that is the last question here. What happens when you stop depot injection? And for this one, I'm not just talking about the depot, also other hormonal methods, hormonal IUD, hormonal implants, the pills. So what happens is that these synthetic hormones, the synthetic progesterone, the synthetic estrogen, they remain in your system and they keep interfering with your natural hormone production. And that is what causes hormonal imbalances. That is what may be causing you to struggle to conceive, even though you may be getting a period. Sometimes some women get a period and they think, or they bleed. Let me say, sometimes women bleed and they think it is a period. It is not. A lot of times, if you scrutinize that period, is it healthy or is it not healthy? A normal healthy period lasts between 3 to 7 days. It is, or it has some texture, like it is of medium texture. So you may find some small little clots there. That tells you that your uterine lining is healthy. It should be bright red. It should not be heavy or too light. And at least every day you should use minimum two pads in a day. That is a normal healthy period. But if you're bleeding, but this period is pinkish in color. It is very light. It has no texture. It is just a very simple flow. That tells you that your uterine lining needs to be rebuilt, so it is very thin. Also, that is not a normal healthy period at all. You may not be ovulating at all. So are you having a normal healthy period, or is this what we call a withdrawal bleeding, like you stopped using the birth control method, so there are no extra uh, what synthetic hormones being pumped inside your system, but you still your cycle has still not reset, and it needs a lot of support. So gonna I think I'm gonna end here, because there are no more questions maybe to address. If you need hormonal support, if you need care, if you need